Okay guys, this week, or in this topic for this week, we're looking at the Casemix payment system. What is a Casemix payment system? Well, literally, quite simply, it means the mix of cases that a health service treats. So what are the cases that come into health service and how do we treat them? And prior to the introduction of the ABF payment system by the Commonwealth Government, Victoria actually came up with this whole idea of the Casemix system. And it was one of their drives behind how they actually funded health service delivery within the Victoria public health sector. So what is it? It's a method of allocating funds, identifying the key areas where we actually need to put funds into. It also is a way that we can provide funding that is transparent and there's a lot of equality. So making sure there's equity, transparency and accountability across all those areas within a healthcare system. It's also a platform for driving allocative and technical efficiency. So efficiency when we allocate resources, but also looking at the technical aspects of delivering healthcare in that system. What isn't Casemix? What is a Casemix payment system not? So a Casemix payment system is not a policy in its own right. And it doesn't determine the level of funding the hospital receives, nor is it states the size of a budget of a healthcare system. It doesn't determine that. It's just a way of realising how we fund certain areas. It doesn't also limit the amount hospitals can actually spend on individual patients. So if one patient is a more complex case and needs to stay longer or needs to have X treatment performed or needs to see X specialist in the system, it doesn't dictate how much we actually spend on that patient to get them well. What are the basic requirements of the Casemix system? Well, we need to have a classification system on how patients are treated. And this is how we use the diagnostic related groups, DRGs, and you'll see these popping up all over healthcare system. What's a DRG? A DRG is basically a universal way that a nurse, a doctor, an allied health professional, an administrative person in the hospital can all have the same language around a case that a patient's been treated into. And it has a unique identifying number, or a unique DRG number. Also, you need a count of all the patients that you treat. So you actually have to have a good data collection of all those patients that you're actually treating. Then you need to be able to show what the costs of all those patients are. So the cost of treating all those patients. So what does that funding model look like? Well, at the end of the day, you want to know the cost weight of what you're trying to accomplish. What is the cost weight? The DRG cost weight is the average costs of the patients in a DRG, so within that coding, divided by the average costs of all patients across all DRGs. And that gives you a diagnostic related group cost weight. And it gives you an idea of how much you can attribute spending to that group. That's all for this video. We'll see you next one.